Today we will be discussing something called as labial bows, basic structure and its indications and various modifications. So labial bows are nothing but these are components that are used for both overjet reduction and for providing anterior fixation. Means to say basically for retention. A wide variety of labial bows are available for use in orthodontics. They are as follows. We have short labial bow, we have long labial bow, we have split labial bow, Roberts retractor, reverse labial bow, and fitted labial bow. There are other modifications of labial bows are also available. Coming to the short labial bows are made up of 0.7 mm round stainless steel wire. Again, it depends on the function, whether we have to go for retraction or whether we have to go for retention. Generally, the appliances will be fabricated with 21 gauge if we are looking forward for retraction and 19 gauge if we are looking for retention. So it is constructed in such a way that the bow contacts the most prominent labial surface of the anterior teeth and ends in two U-shaped loops that extend as a retentive arms between the canine and premolar before getting embedded in the acrylic base plate. For space closure, the bow is activated by compressing the loops of the bow by 1 to 2 mm. So roughly these are the pictures showing the short labial bow. Basically, it will be connected to the acrylic plate by using a retentive arm. The uses of labial bow includes retention purposes as a component of Foley's retainer for minor overjet reduction and for anterior space closure. So the limitations of labial bows are range of action is limited because of its stiffness and low flexibility. And coming to the next one, that is a long labial bow. So it's again a modification of the short labial bow design. So it extends from first premolar of one side to that of the collateral side. The distal arm of the U-loop extends between two premolars and ends as a retentive arm. So again, it is activated by compressing the loop 1 to 2 mm so that the bow is displaced palatally by 1 mm. The uses goes like it is indicated in minor overjet reduction for small amount of anterior space closure and for closure of the spaces distal to canine. Come to the next one, that is split labial bow. So again, this is a modification of conventional short labial bow that is split in the middle. So this is done to increase the flexibility of the otherwise stiff labial bow. Again, the wire used is 0.7 mm round stainless steel wire. It has two separate short buccal arms, each with a U-loop ending distal to the canine. So activation is done by compressing the U-loop by 1 to 2 mm. So these are the uses of split labial bow. So basically it is used for anti-retraction and closure of midline diastema. So this is the diagram showing the closure of midline diastema. Now come to the next one, that is called as Roberts retractor. So these retractors are used whenever there is high amount of proclination or the overjet is more. So wire used is 0.5 mm. It extends over the labial surface from canine to canine, and instead of a regular loop, it incorporates a 3 mm internal diameter hex at the base of the loop. So it is used with Adams clasp on buccal teeth for retention in patients with severe anterior proclination, as it produces a lighter forces over a long span of activation. This is a diagram which shows Robert retractors with the helix at the end. Then comes the next one, that is reverse labial bow. So this type of labial bow is so called as activation of the bow. It's done by opening the U-loop instead of compressing, as seen in the conventional labial bow. So usually whenever the other labial bows are activated by just compressing the loops. But here basically what we are trying to do is like we are opening the loop so that there will be an anterior retraction or the anterior teeth will be palatally displaced. So that is a difference of our reverse labial bow when we are comparing it with the other kind of labial bow where it is being compressed to activate the loops, to activate the labial bow, but in reverse labial bow it is by the opening of U-loop, which is major difference between the reverse labial bow and the other labial bows. So the loop is placed distal to the canine and distal arm is bent at right angles to extend anteriorly as the labial part of the bow. The free end of the mesial arm is adapted between the canine and the first premolar and eventually get embedded in the acrylic base plate. So roughly this is a diagram showing the reverse labial bow. Then comes Mills retractor. So this is a kind of retractor, it's kind of a modification whenever there is high amount of overjet. So whenever there is higher amount of proclination, which shows increased overjet clinically, it's better to go for this kind of retractors rather than simple labial bows like short labial bow or long labial bow due to something which is called as the glide plane effect, where the population is increasing. When we try to activate the labial bow is going to slip cervically, so it doesn't serve the purpose. So for that matter, we have to think about mace retractor for modifications. So coming to the mace retractor, it has been extensive looping in its design to increase flexibility in the range of action of the retractor. The anterior part of the bow extends till mesial of the canine and then forms a complex loop gingivally before ending in the retentive distal to the canines. Coming to the uses, it is indicated in patients with increased overjet that cannot be managed with our short or long labial bows. Limitations of these retractor includes difficulty in the construction and poor patient compliance. So this is a diagram which is showing the male's labial bow. Now come to the next one, that is high labial bow with apron springs. So here basically we have a higher wire to which a small wire will be wound. This type of labial bow extends high into the labial vestibule, so it acts as a support onto which apron springs are attached or wound. This type of bow is made highly flexible because of these springs. So how these springs are activated are apron springs. They are activated by bending towards the teeth up to 3 mm at a time. This is how our high labial bow with apron springs will uh, do it action. So basically we have a high labial bow which will be somewhere near your vestibule, which is made of a thicker wire and to which these small apron springs will be wound. So these springs are being pushed against the tooth, taking support from the higher arch wire, which is located somewhere in the near to the vestibule without hurting it. So that is how the springs are being activated. Come to the uses for retraction in case of large object, which again cannot be handled with our conventional short or long labial bows. So the limitations include difficult to construct and can cause soft tissue injury sometimes if we are not preparing it correctly or constructing it correctly. It may also lack patient compliance as too much of the wire is visible. Now come to the next one, that is we have fitted labial bow. So this type of labial bow is so called as it is adapted to the contours of labial surface of anteriors. So basically these are used once at the end of your orthodontic treatment for the purpose of retention. So the U loop is usually smaller when compared to the conventional labial bows. So the main purpose of these fitted labial bows include uh, retention. So the wire will be adapted into the contours of the teeth and the U-loop will be less in dimension when compared to the short and long labial bows. Okay, so before winding up, the very important section which you have to remember is these kind of labial bows can be used for the purpose of retraction as well as for the retention. Now, the configuration of the wire used or where the bows should be placed plays a crucial role in fabricating the appliance. For example, if we require a retraction, that is, we have to close the spaces. In that is the case, we have to go for something which is called as retraction appliance, where the basic parts of bows, like labial bow, the horizontal labial bow, U-loop, and the retentive arm. So these are the basic components of a labial bow. So if it is for retraction, basically the bow has to be located at the junction of incisal and middle third of the teeth. And the U-loop has to start from exactly from the contact point between the lateral and the canine. And similarly, if it is for the retention purpose, the horizontal bow has to be in the middle third of the anteriors, and the U-loop has to be started from the mesial third of canines. And the main difference again lies in the thickness of wire which we use. If it is for retraction, we have to go for thinner wires or preferably 21 gauge wires. And if it is for retention, we have to go for thicker wires or 19 gauge wires. So these are the basic difference and the method of fabrication of labial bows will be clinical situation arises. Thank you.